歡迎大家出席今日。
Welcome to the press briefing. With us today, Dr. Albert Au, Principal Medical and Health Officer, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Hospital Authority. They will brief us on the situation at the HA and the positive cases. Dr. Lau, please. Good afternoon. First, I'd like to report the number of patients in our hospitals. Currently, 1,525 confirmed patients are staying in hospitals, of which 168 are newly confirmed cases. Of patients in isolation facilities, 474 are staying in isolation wards, 92 are staying in Tier 2 isolation wards, 430 are staying in the North Lantau Hospital Hong Kong Infection Control Center. A total of 127 patients are new cases. Yesterday, another 5 patients were reported to be in critical condition and 3 more in serious condition. Of the confirmed patients staying in hospitals, 23 are in critical condition and 24 are in serious condition. 11 patients in critical condition are staying in intensive care. For the 22-month-old baby girl staying in the children's ICU at Pamela Youth Netherlands Eastern Hospital, her conditions continue to deteriorate and she passed away at 12:56 p.m. today. We are saddened by her passing and we have sent our condolences to her family. The PYNEH has attended to the family of the baby girl, and where needed, support would be rendered. The relevant case would be referred to the coroner. We understand that there is a lot of concern towards this case, but since it was passed on to the coroner for investigation, in order to not affect their work, we would not disclose further details of the case. This case would count towards the death toll for tomorrow. Meanwhile, we would like to report another case where a child patient is staying in children's ICU. It's a 35-month-old boy. On July the 29th, he had fever and he was admitted to a private hospital, and on the 30th, he did a COVID PCR test. His CT value was 20.7 and he had convulsions and he was transferred to the A&E ward of Yan Chai Hospital. We continue to observe convulsions. He was admitted to a ward and there were 6, he experienced 6 convulsions in total. A drug was prescribed and the convulsions stopped. We performed another PCR test on the patient and his CT value was 22.6. He was admitted to children's ICU and after that he experienced fever and the fever died down upon the prescription of medicine. We carried out a CT scan on his brain. The results were normal. The patient is currently in stable condition and he has no fever. And the patient will be monitored at the ICU and he is currently in stable condition. I call upon everyone to have their children vaccinated if suitable vaccines are available, and if your children is not yet fit for vaccination, please do get vaccinated yourselves. 6 new fatalities are reported today, including 4 males and 2 females, aged 52 to 84 years old. None of them came from residential care homes. Only one of these patients completed 3 doses of vaccination, 4 received 2 doses, and 1 was unvaccinated. I would brief you on details of these cases. First, an 84-year-old male patient. Starting from July the 21st, he started experiencing discomfort, and on the 23rd, he tested positive through RAT. On the 24th, he visited a designated clinic, and antiviral drug was prescribed. The patient had a number of underlying diseases, including hypertension, B12 deficiency. He is a hepatitis B carrier, and he had colon cancer, and he was fitted with a pacemaker. And his kidney functions were also subpar. Yesterday, he was found to be unconscious at home. His family called an ambulance, and he was taken to A&E of Queen Mary Hospital. Resuscitation was attempted to no avail, and he passed away yesterday. Another case was an 80-year-old female, or 60-year-old female. The male patient I talked about received 2 doses of a vaccine. Another 60-year-old female patient also had a number of underlying diseases, and she was bedridden, and she had to be attended to by others, and on the 17th of July, she started coughing. She had mucus, and she had a runny nose, and she tested positive through RAT the same day. And on the 18th, she visited a designated clinic. She was still in poor condition. She was dehydrated, and on the same day, she was admitted to hospital. She was admitted to Princess Margaret Hospital. She had a number of underlying diseases, and she was bedridden. Her lung function was inferior, and her conditions continued to deteriorate before passing away yesterday. Another case was a 58-year-old female patient. She had no record of vaccination, and she also had a number of underlying diseases. She was a hepatitis B carrier. She had diabetes. She had tuberculosis, and she had cirrhosis, and her blood platelet level were low. And on the 15th of July, the patient's son tested positive through RAT, but he did not seek medical attention, and he did not take any drugs. And on July the 30th, her family member saw that she was weak. She didn't eat well, so an ambulance was called, and she was taken to an A&E ward. And from a lung scan, her lungs were found to be scarred, and she had to be intubated at the A&E ward, and she was taken to ICU. We prescribed remdesivir, which was an antiviral drug, to the patient immediately. Her viral load was constantly rising, which means she did not respond well to the treatment or drug. Her lung conditions continued to deteriorate, and she passed away yesterday.
And there's another patient who's an 84-year-old male, and he has taken 2 doses. On the 27th of July, he went to our A&E department, and he told us that 2 weeks ago he was already diagnosed with COVID, but he didn't go to a doctor and didn't take any medicine. Because he himself has dementia, and he doesn't walk well. He sits all the time. He's also suffering from hypertension and diabetes. He also has arrhythmia. On the 27th of July, he went to our A&E, and he was in a poor condition. He didn't eat well. He was frail. He was admitted to our ward, and he has been deteriorating, and he passed away, unfortunately, yesterday. And for this patient, he's a 75-year-old male. He has a lot of chronic diseases. For example, diabetes, arrhythmia, hypertension. He had suffered a stroke, and he also had a chronic obstructive pulmonary disease. On the 23rd of July, he went to an A&E department because he was not breathing well. He felt that his heart was beating fast, and he also vomited, so he was admitted to the hospital. His condition was quite poor, and his condition kept on deteriorating. In March this year, he was infected with COVID already. And after he's been admitted to hospital, he was tested again. He carried the virus and he deteriorated and unfortunately passed away yesterday. As for the last patient, on the 25th of July, he passed away. On that day, he was working, and his colleague discovered that he was unconscious. And he called an ambulance, and the patient was sent to the A&E. Resuscitation was carried out, but he passed away at the A&E department. His body was sent to a public mortuary. A coroner conducted an autopsy on him. And yesterday we were told that he was tested positive for coronavirus. Well, 1 week before his death, he took RAT and it was positive. He didn't go to a doctor and he didn't take any medicine. After 1 week, maybe his RAT result was okay, so he went back to work, but he fainted and then he was sent to hospital and died. Well, when we look at the Department of Health information, the patient's pass may not be related to COVID because we find that he has coronary artery problems and also had high blood pressure and a high level of fat in his heart. So I have reported on 6 death cases. These people are not from care homes. So for the elderly patients, most of them live at home, and many of them have not been fully vaccinated. They may have taken 1 or 2 jabs, but our experts say that people should take 3 jabs in order to have enough protection. So I would like to call on members of the public, or for the elderly who live at home, even if you've taken 1 or 2 jabs, it's not enough. You have to take 3 doses. So as young people, we should help our elderly. Maybe they do not know where to get their vaccination and how to make the arrangements. So please try to help them, in particular for the elderly that are staying at homes. If there are elderly neighbors, please also try to help them. Because if they are vaccinated or if they are fully vaccinated, even if they contract a disease, the condition may not be that serious. Now, we've seen elderly people who are above the age of 60, and if they display symptoms, even if they find out that they are positive, they wouldn't go to doctors or they wouldn't take medicine. So they would think that it's just an ordinary flu, but it's definitely not. Well, if you take medicine, the viral load will be reduced, and the possibility of deterioration would also be reduced. So for elderly patients or patients with chronic diseases, if you display symptoms, please go to a doctor as soon as possible, because your condition may deteriorate very rapidly and very suddenly. If you can go to a doctor as soon as possible, and if you can take medicine as soon as possible, then the chance of your condition turning serious will be less. And of course, you will recover sooner. Now, for confirmed patients, now there are many channels for you to seek medical consultations. We have 7 designated clinics. And for those who are quarantined at home, well, you can call the HA's hotline, 1-836-115. Or we have an app called HA Go. You can make an appointment for consultation. And lately, we are using more telemedicine and remote consultations. Now you can use our app, HA Go, or use a tablet. Then you can consult our doctors, and we can also deliver medicine to you. If you can take medicine early, then you may not turn that serious. And for some private doctors or hospitals, now they can also provide COVID drugs for patients. Now, if you have not been fully vaccinated, if you have not taken 3 jabs, please go get your vaccination as soon as possible, so that even if you have the disease, it won't be serious. Yesterday, 130 patients recovered. 108 of them have been discharged, and 2 patients were screened when they were admitted to hospital, and they were found to be positive, and 5 patients who shared the same wards are now quarantined. And for staff who are confirmed, 26,107, and 25,539 staff members have returned to their work. And for people who accompany the family members or friends to hospitals, or those who would like to visit patients in hospitals, now in order to prevent the further transmission of virus in hospitals, we have tightened the requirements for hospital visits. And for those accompanying patients, from today onwards, I'm sorry, it's not people who are accompanying general patients. We're talking about a parent accompanying his wife to the hospitals. They need to have a 38-hour PCR negative result. And for the pregnant women, if they are 30 weeks pregnant or more, all the people accompanying them should take PCR tests regularly. If the baby is born earlier than the due date, the people who accompanied who visit them would also have to take 24-hour out. Would need to have a 24-hour RAT negative result. And also for carers and for pediatric patients, they may need long-term care by the family members. So for these carers who stay in hospitals for a long time, they have to take 2 PCR tests every week. This is to ensure that they are free from virus.
佢有病毒嘅時候咧，傳染咗俾
This would prevent possible transmission to their children or other children. This arrangement would be enforced from today, but we do realize that time is needed to adapt to this arrangement, especially for the husbands or the fathers of expectant children. So we will adopt such arrangements in a flexible manner. The hospitals would also remind relevant individuals and explain the testing requirements. Good afternoon. I would now report the latest figures on COVID-19 cases as yesterday. Yesterday, there were 4,019 locally acquired cases, including 1,486 that tested positive through PCR tests and 2,533 positive RAT results verified by PCR. Yesterday, there were 235 imported cases, 213 tested positive through RAT, and 22 tested positive through RATs. In terms of fatalities, as Dr. Lau explained yesterday, there were 6 new fatalities. The total death toll since the 5th wave started is 9,296 cases in Hong Kong. For the of the 235 imported cases yesterday, 132 were found at the temporary specimen collection station at the airport. 80 were detected at quarantine hotels during the quarantine period. The remaining 23 cases were detected after the quarantine period at the community. Most CT values were high at above 30, so these were possible reinfections. The cases came from 48 places. 8 places saw more than 10 cases, including UK, India, Thailand, Singapore, Australia, Canada, the Philippines, and the United States. For the remaining 40 countries, they saw less than 10 imported cases. For residential care homes, yesterday, 1 new residential care home for the elderly recorded new cases. The Jockey Club K Ji Yuan in Sha Tin. A resident displayed symptoms on July the 30th. He tested positive the same day through RAT. He received 2 doses of vaccine. 2 other residents were close contacts. From 24th to 30th of July, a total of 25 residential care homes saw cases in their residents or staff members, and residents had to be sent to quarantine facilities. These include 17 RCHEs involving 19 residents and 11 staff members, and 8 residential care homes for the disabled involving 12 residents and 8 staff members. For schools, today is Monday, so we had a large number of cases. There were 940 cases, including 784 students and 156 members of staff and teachers. 558 schools were involved over the past 7 days. 365 schools saw 2 or more cases. Of the 940 cases, the sampling dates were most were sampled between last Friday and this morning. 216 were sampled last Friday, 256 were sampled on Sunday, and 160 were sampled this morning. For 9 schools, we saw clusters in some of their classes, and the classes had to be suspended first. St. Stephen's college affiliated primary school in the Southern District. There were 2 floors in a hostel for primary 6 students. There were a total of 8 cases in 7 rooms. It was a hostel for primary school students, so we recommended class suspension for all primary classes, and there were and another school was Singmaho Zhonghok, and we recommended suspension of class. Hong Kong Lutheran Kinming Nursery in Sai Kung in the pre-nursery class, there were 16 cases, including teachers. We recommended class suspension. The 4th school was Sai Dek Yaojiyuan in Shunwan, in Lei Mok Shu, in the class K3A. There were 3 cases out of 30, and 1 teacher also tested positive. St. Joseph's College Class 4F in Central and Western District, 3 out of 25 tested positive. St. Antonio's Primary School in Kuntong in Class 2C, 4 of 20 tested positive. And St. Domingo's Kindergarten in the Eastern District, there were 3 cases in a class. Sha Tin Chongqing College, for 6 secondary 2 students took part in a basketball competition. There were 6 cases, 2 from 2D and 4 from class 2C. Finally, Tongchong Airport Kindergarten in the 2 to 3-year-old class, there were 4 positive cases out of 24, including the teacher. For the Hong Kong C School in the Sun District, at the hostel on the 3rd floor, there was 1 prior case, and we recommended suspension of class, and close contacts had to be quarantined. There were 3 new cases today, including 1 from class 2A and 2 from class 2B. In the hostel altogether, there were 7 positive cases among students in 4 classes. We recommend suspension of class 2A and 2B, and students in the same room would be put on home quarantine. The floor is now open for questions. Please raise your hand and identify your organization before you speak. The gentleman in white at the back, please. Good afternoon, this is Cable TV. I would like to know about the details of some cases. You talked about Sha Tin Chongqing Primary School. Did you mention class 2B or class 2D? What about class 2C? For St. Stephen's Primary School, the hostel saw 8 cases. Do we expect this to arise from certain activities in the hostel, or were there activities that took place between hostels? Can you share any preliminary investigation results? The chief executive said in an interview this morning that he would shorten the quarantine period for inbound visitors as soon as possible. So in terms of the scope of the color code system under Leave Home Safe, can you give us any update based on the current trend? Do you feel that it's time to shorten the quarantine period based on the current trend? Would such move worsen the pandemic and create a stress on hospitals? Would the 5+2 or 4+3-day quarantine arrangement be appropriate? You have asked a number of questions already. Thank you very much. For Sha Tin Chongqing School, it was a secondary school. There were 6 cases in total involving an inter-class basketball competition. 4 students came from class 2C and 2 students came from class 2D. So there were 6 students total.
The second question is about St. Stephen's Primary School and the hostels. For the hostel, there are 90 students, and there are 2 floors, including male and female students, and 8 students are confirmed. They are all primary 6 students, because this hostel is for primary 6 students. As for they are scattered in different rooms. 7 rooms are involved, and for 1 room, 2 students are infected. And for most of the rooms, they would accommodate 3 to 4 students. This is a hostel. In a hostel environment, students would use common areas, for example, the bathrooms, etc., or they would eat together and they would have activities together. And they would take off their masks sometimes in the hostels. So that's why there's a transmission. And this is Omicron, and it's quite transmissible. So this would happen. As for your third question, is about quarantine for the arrivals. Well, for the government and the Health Bureau, they are looking at different data, and they're trying to make adjustments basing on scientific evidence. For Hong Kong's epidemic, well, most of the cases are local cases. If you look at the figures we announce each day, over 90% or even 95% of the cases are local cases. As for imported cases, it doesn't have a huge impact on Hong Kong's epidemic situation. Dr. Lau? Well, for the hospital numbers, well, you can see that the number is going up today. We have 1,525 confirmed patients in hospitals. Now, if there are more confirmed patients, of course, many more people will be hospitalized and the number of deaths will increase. But how to reduce the number of serious cases and death cases, this is the most important thing for us. Members of the public may think that, well, the epidemic has been here for a long time. They are fatigued. They want to go out. They want to go to restaurants and have gatherings. And they even take part in activities during which they would take off their masks. So how can you reduce serious cases and death cases? Well, this is our goal. We have repeated many times, vaccination, vaccination. We have been talking about this so many times. Why are we still talking about this? Because some patients still haven't taken their shots. Now, today we have 50-something years old patient. He's passed away. He's suffering from chronic illnesses, but he has never taken any jabs. So for some Hong Kong people, they may still have some misunderstanding about vaccination. And this is very important. We must push the inoculation rate. Now, at the beginning of the 5th wave, we have seen a lot of patients from RCHEs, but now the situation has improved. For those who have taken 1 shot, it accounts for over 90% and over 80% of the elderly home residents have been vaccinated. However, for the elderly in the community, or for people with chronic diseases, for example, those who are suffering from hypertension or diabetes, they are not doing this. Actually, hypertension and diabetes are high-risk factors, so vaccination is very important. And taking medication as early as possible is also very important. Even though you have very mild symptoms, if you just have a runny nose and you cough, but if you are over the age of 60, or if you are under the age of 60 but you have chronic diseases, or if you are overweight, you have high blood pressure, you have diabetes, you must pay attention, because if you are infected, the chance of your condition becoming serious or even die is higher. So if we have more patients, we would provide more beds, and also we have other facilities, for example, AWE, etc. We do not want people hospitalized. We do not want to see so many deaths. So we hope that you can get your vaccination. And if you have symptoms, go to a doctor as soon as possible. We also have teleconsultation, and we can deliver medicines to you at home. And for teleconsultation, the number has increased by 3 or 4 folds in a few days. And for our designated clinics and for our colleagues who are responsible for teleconsultation, they would always do this. That is, if patients have high risk factors, no matter whether they have been vaccinated or not, they would be prescribed with medicine as soon as possible, but we do not know who the patients are. So if you do not feel well, you should go to a doctor as soon as possible and take medication as soon as possible. Then that would ease the burden on the healthcare system. And then we can be better prepared, and we can provide beds to the most needy people. I'm from TVB. Well, you talked about 6 death cases. 1 case was reported by a coroner. And how old was that patient? What's the gender? And now there are some overseas studies saying that after taking Pfizer drug, the case may still be re-positive. Have you seen this in Hong Kong? So are you still using the Pfizer oral medicine? And for MSD oral medicine, have you also seen similar cases? I do not have the relevant data with me. We don't know whether the re-positive cases are related to these medicines, but we have an evidence that is, if you take the medicine, that there would be less serious or death cases. So for the elderly and for the people with chronic illnesses, if they do not take medicine and if they are infected, their condition will become serious or they may even die. So we have looked at both local and overseas data. Well, for your question, when we have more data, we will share them with you. But at this moment, you must remember this. That is, we have to reduce the burden on our healthcare system. The gentleman here. I'm from AM 730. I want to ask about the 70-year-old female patient, and she was positive on the 15th of July, and on the 30th of July, he was hospitalized. So what happened during that period? And for the coroner's case, is a 52-year-old male, right? What are his symptoms? Just now, Dr. Lau said that many patients do not go to doctors and do not take medicine. So if he has no symptoms, can he also go to a designated clinic and tell the staff there that he's suffering from chronic illnesses, he wants medicine? But if a person is asymptomatic, what should he do? And for the Sha Tin Songshan College, how many people take part in the basketball match? And for those 2 classes that are involved, will they be suspended? And also for people accompanying pregnant women to clinics, they have to take PCR tests. So if they have not taken the PCR test, they cannot accompany the pregnant woman to the relevant services. You asked about a 75-year-old patient, 70-year-old lady, a 70-year-old female patient. I'm not sure which one you're talking about. I do not have the relevant information. The 58-year-old one? The 58-year-old lady, she is suffering from chronic illnesses. She is a carrier of hepatitis B. She has diabetes, and she once had tuberculosis. Well, she's suffering from cirrhosis. And also, on the 15th of July, she took an RAT and it was positive. She didn't go to the hospital. She didn't take any medicine. She remained at home. and her condition kept on deteriorating. She couldn't eat, and she was very tired, and her family members called an ambulance. The ambulance sent her to the hospital. I didn't mention this just now. Her blood sugar level was very high, and in her lung on the right-hand side, well, we can only see opacity. So for this female patient, she didn't take any jab. So she didn't have the antibody to fight against the virus. She showed symptoms, but she didn't go to a doctor. So that's why she didn't have any antiviral drugs. Well, she suffered cirrhosis and diabetes, so she was not very fit. So she couldn't really fight the virus. And again, she didn't go to a doctor early, so when she was in a very poor condition, she was hospitalized. We have done a lot trying to help her in the hospital, for example, trying to control her blood sugar level, etc. And she was in ICU, and remdesivir was prescribed to her, but still she passed away.
即係自己係後生50幾歲。
The patient had chronic illnesses, despite only being in his 50s. Should anything happen, one should seek medical attention immediately. Even through telemedicine, the doctor would consult your medical history and look at your symptoms before deciding whether drugs would be prescribed. If medication is warranted, it would certainly be prescribed. So patients with needs should be prescribed with the medications in order to help their conditions. This is the message we are hoping to convey to the public. That way we can avoid such tragedies in the future. For the inter-class basketball competition at Shatin Chongqing School, it involves Sandry School, Sandry 2 students. 83 students took part, and there were 6 positive cases. In Class 2C, there were 4 female stations. Class 2B, 1 male and 1 female student. The competition took part from the 25th to 27th of July. For these 6 cases, they all took part in the basketball competition, and there was a possibility that they took their masks off when playing, and that's why some students were infected. We did not see any clusters in other classes. We will continue to monitor the situation. For these 83 students who took part in the basketball competition, they should stay away from school, and they have to do RETs every day. And in this school, there were sporadic cases in certain classes, and we don't see any epidemiological link with this competition. Some reporters asked about the death toll recently. In some of these cases, we saw that the patients tested positive at home. Some were sent to A&E wards. Others did not seek medical attention, and subsequently their conditions worsened. For some of the cases, after they tested positive, they did not report the results to us. So for anyone who tests positive through RET, they should report the results through the DHS online platform. We will then verify your RET positive results through PCR tests, and your particulars would be submitted to the HA immediately, and the HA can follow up as appropriate, including prescribing medicine. If high-risk factors are identified, they would get in touch with the patients through relevant apps. Once cases are reported, we can arrange for patients to be transferred to isolation facilities or hospitals. If any elderly family members of yours test positive at home, please help them report the positive results online. And if you have difficulties registering such cases online, you can call hotline 1-833-6119. So through this hotline, you can register your particulars and we will get in touch with you as soon as possible. The lady at the back row, this is Orange News. A question for the HA. For the 15-month-old boy who tested positive, did his family members test positive? Do you know of the source of infection for this baby? And which subvariant did he contract? For the 84 male patient who passed away, 2 weeks before he was admitted to A&E, he had tested positive. Did you find out about his conditions in those 2 weeks? And when he was admitted to hospital, what was his CT value? Finally, a question for CHP. The number of local cases today is 400 less than the previous day. What is your assessment of the trend? Do you think we have topped out in terms of the number of positive cases? In recent weeks, we observed a rising trend in caseload. In mid-July, the local daily caseload was between 3 and 3.5 thousand, and from the 21st to 26th of July, it rose to 4,000 per day, and in recent days, the number of local cases remained at about 4.5 thousand. Of course, there would be slight fluctuations to the daily figures. After a weekend, we might see a lower caseload. But nonetheless, we still saw a gradual rising trend, and the caseload would double every 2 weeks or so. We are yet to see the daily caseload max out, so we will continue to monitor the trend. For the 35-month-old boy, his kindergarten saw 1 or 2 other positive cases among the students. The baby is currently in stable condition. He had twitching, possibly due to fever. He had a brain scan. The results were normal and there was no edema. He was placed in children's ICU as a precaution, so we can closely monitor his situation. For the 84-year-old male patient, on the 27th of July, he was admitted to A&E. He refused to eat at that time, and his conditions continued to deteriorate. He had underlying diseases such as diabetes, arrhythmia, dementia, and he was immobile. He was not able to communicate properly, and his family took him to A&E, and checks were carried out, and he was deemed to be frail and dehydrated. It was rather common for elderly patients, especially for those with dementia. They might not drink a lot of water. So if you believe your family members have COVID, please seek medical attention for them as soon as possible. Even for elderly patients, medication could be prescribed. And this is especially true for those who are not eating or drinking well. That would affect the liver functions and be potentially life-threatening.
I'm from Mingpao. I would like to ask CHP about the Hong Kong C school. Now, there are 3 more cases. So are they also living on the 3rd floor of the hostel? And how many cases in total from the hostel? And for the HA's new arrangements, that is for the people accompanying pregnant women to hospitals. Then for these people, if they cannot show it 48-hour test results, then they would not be allowed into the hospitals. And for those people who are staying in hospitals for a long time to accompany their family members, they have to do 2 tests per week. So what's the frequency of the tests? How many days apart? And for the child who is going to a kindergarten, and there have been some other cases from the same kindergarten. So are they from the same class in the kindergarten? Just now, Dr. Lau talked about medication, and now more people are using this service. So how many people have used this service, and how many people have been delivered with medicine? Thank you for your questions. And for the Hong Kong C school, the floor affected is the 3rd floor. For this hostel, I think there are 3 floors, and a total of 46 students live there. Today, we have 3 more cases. They all returned home last Friday. Well, for the people that are not close contacts, they have returned home. And for this particular floor, there is a total of 7 cases. They are in 4 rooms. For this floor, the warden is also infected. 7 students are involved. They are from 2 classes. They are class 2A and 2B, and each class has 25 students. So for the hostel students, we also suggest that these 2 classes be suspended. We will continue to monitor the situation. And you also asked about the child in pediatric ICU. He goes to Luk Yang Kindergarten in Tsuen Wan. He's in the PM session. Well, for his class, no other classmates are confirmed. But for that school, in recently there have been several cases, so we are still carrying out our investigation. As for the people accompanying pregnant women, well, if he's a prospective father, if he wants to go into the labor room with his wife, then after 37 weeks of pregnancy, he should keep on doing PCR tests, because he wouldn't know when the baby will be delivered. So we hope that the prospective father can provide a 48-hour PCR negative result to us. But we also would exercise discretion. If the baby is born on a day not expected, then he can provide us with a 24-hour RAT result. And then afterwards, he should go to take a PCR test as soon as possible. And within 2 days, he should tell us the results, no matter whether the result is negative or positive. Now, if it's positive, then we will do a lot of tracing and we will carry out investigation. Well, we say that this will start from today. That is, we hope that they can have PCR negative results. But if the due date is tomorrow, then they may not be able to do it. Then you can use the 24-hour RAT result. So we hope that you will try to follow this rule as much as possible, because we are trying to protect their wives. And if the prospective father is tested positive, he would not want to go into the labor room. He doesn't want to infect other people, his wife or the baby. So I hope that you can cooperate with us. Well, in the initial stage, we will try to be as flexible as possible, and we will try to understand the situation of different families, and we will tell them when they should do it, and we will explain to them about the arrangements. Just now, maybe I didn't make myself very clear. For the 35-month-old boy, he's in Princess Margaret's Hospital Pediatric ICU. As for carer, it's the same. We hope that carers would have PCR negative results, because we want to protect the patients that they are taking care of. As to how frequent it should be, is just common sense. You won't do it on 2 consecutive days and then you don't do it for the rest of the week. So they should do it regularly. If they're sure that they are free from virus, then they can take care of their family members. And if they are infected, of course, they shouldn't be taking care of their family members. So for these carers, well, they are very familiar with our colleagues already, so they can ask our colleagues when they should do the test. They should do the test twice a week. So on which day should they do the test? Because we just want to protect the patients. Because community transmission is quite serious nowadays. You don't know when you are infected. So if you are infected and if you take care of a person very closely, even if you wear a mask, you may still infect the patients. So we are all trying to protect the patients. As for telemedicine, I talked about this earlier on different occasions. We started to do this on the 11th of July. Initially, it was like a pilot scheme. We selected some patients. Some were older, some were younger. We tried to find out whether they could use the system efficiently, and then we made improvements. We also had medicine delivery service, and now the quota is getting higher. We hope that for Hong Kong people who would like to use the telemedicine service, they can make use of this service and they can take the medicine that we deliver to them. Well, I only have the figures for these few days. About 200 plus patients used this service yesterday, and about or over half of them were prescribed with antiviral drugs. Not all of them are elderly people, some are younger. And if they do not have high risk factors, we may not prescribe the medicine. I'm from Now TV. I would like to ask about the deceased patient who's sent to public mortuary. How old is he, and has it been vaccinated? You said that we have not seen the peak of the epidemic yet, and the social distancing measures will expire soon. So do you think the measures should be tighter? Well, for the epidemic, if we look at the trend in the past 2 or 3 weeks, is still getting more serious, though not very fast. But is the number of cases has been growing gradually. we expect the number of cases to continue to rise.
疫情都可以話係用
The pandemic remains serious, so we call upon everyone to observe the social distancing measures, even though lives have gradually returned to normal. We must be aware that there are still plenty of transmission chains in our community, and the risk of infection is gradually rising. So the unvaccinated should receive jabs as soon as possible. Even vaccination cannot completely prevent infection. So for those who go out or visit high-risk premises, please observe infection control measures, for instance, by wearing face masks. And if you visit high-risk places, you may wear N95 or KN95 masks. For the for the patient who passed away on the 25th of July, it was a male patient. He had chronic illnesses such as hypertension, hepatitis B, and hypolipidemia. Autopsy was carried out at a public mortuary. There was cirrhosis in his liver, and his heart was swollen. So the actual cause of death would be determined by the forensic doctor, and the preliminary diagnosis is that it was unrelated to COVID. Thank you very much.